ಈಗ ಆನ್ ಮಾಡಿದ್ದೆ ಸರ್. ಸ್ಟಾರ್ಟ್ ಮಾಡೋಕ್ಕೆ ಮೋಹನ್ ಸರ್ ಬಂದತ್ತೆ. ಸ್ಲೈಡ್ ಹಾಂ ವಾಪ ಇಟ್ಟು ಈಗ ಆನ್ ಮಾಡಿದ್ದೆ ಸರ್.
Okay, first of all, I congratulate Rashmi Institute of Ayurveda for organizing such a wonderful model and drawing competition. Kudos to them. Kudos to Mohan sir, the young and enthusiastic chairman whose inspiration has led their team to do such a wonderful program. I also convey my congratulations to Harish sir as well, the principal of RIA, and my dear brother, my junior, Dr. Abhishek sir, who is working in the Department of Sanchayanam, who is the charioteer of who is the leader of this entire organizing committee. Congratulations to him as well, and congratulations on behalf of everyone. I take this opportunity to congratulate especially the participants, whether you win or not, that's not a point. The point is that you participated, and that is something that needs to be cherished. Actually, when me and Uma madam, when we went through the models and drawings, in fact, we struggled a lot. I mean, that much, all of the drawings and all models were so beautiful and exhibited in such a way that it was very difficult on our part being judged to give prizes, but still we had left with no option but to become rude in your case to select some of the participants. So anyways, according to me, everyone who has participated, all of them are actually the winners. So with that, let me just start my lecture. And when your Abhishek sir asked me which topic I would deal with, so I just chose this particular topic, nervous system. The reason behind this one is that according to the NCSM, nervous system is put in the last semester, in the third semester, and I think in most of the colleges from where you all have come, your teachers might have just started this topic or might not have started, like in my case, or might have even finished that. Whatever the thing it could be. Can I have next slide, please? The weightage of the nervous system, if you see there, it is 14 marks. That means to say that the nervous system can be asked for a long essay, it can be asked for a short essay, or it can be asked even for MCQ as well. So considering the weightage of the nervous system, I chose this topic. And the other important reason for choosing this topic is this is my favorite topic as well. So I would really enjoy teaching this particular thing. Well, I should not say teaching. Why? Because in our as you can see, there is 14. As you can see there, the number of hours that are allotted by the national NCSM is 18 hours. 14 hours to be dealt in lecture hour and 4 hours to be put for non-lecture hour. So it will be a joke if I say that we will finish the nervous system in 18 hours. It is absolutely impossible task as well. Maybe we may finish it just theoretically from the exam point of view, but never for the practical point of view. It is absolutely not possible to finish. And the third important reason why did I choose this nervous system is, as you all know, if you after becoming the Ayurvedic doctors, right? You go to your you may join PG and you may become a teacher, or you may start practicing at your town, or you may practice in your hospitals and all. Like there are quite opportunities after once you finish the BMS. So I'm very sure if you have gone through any of the Ayurvedic hospital, can I know which cases often you will get to see in the Ayurvedic hospitals, guys? just a casual question. Which kind of cases that you would see in an Ayurvedic hospital? Yes, the diseases which are related to the neurological points, right? We Ayurvedic people are sitting in the driver's seat. We are the pioneers in the world to treat Ayurvedic chronic diseases, especially related to the nervous system. So this makes me the third point to be a valid reason to deal with nervous system. So anyways, like I said, when 80 hours is not possible to finish nervous system, how can I finish in just 30 minutes or 40 minutes? This is again a joke. So what I'm going to do is that I'm just going to introduce you the nervous system so that I will be telling you what important things are there, what mnemonics can be used, and how we need to prepare for the examination, what kind of questions can be expected in the nervous system. So these things let me finish in just 30 to 40 minutes without eating much of you have already, had very sumptuous lunch already, and I don't want to be a lullaby singer here, so that you can sleep happily and AC room and all under the fans, and so such a wonderful infrastructure you guys have got. Here I think you are really lucky to be admitted in the RIA. So this is the syllabus, as you can see, that there are 7 points if you see. Yes, nervous system, first is introduction and classification, and then it is talking about meninges, and then brain and spinal cord description, and then there is peripheral nervous system, which includes cranial nerves and spinal nerves as well. And then there is autonomic nervous system, very interesting. Then there is formation and the circulation of the CSF. We will go with that point as well. Last but not least, let us end with the blood supply. So every point, when we go with every point, whether it is brain and spinal cord, whether it is peripheral nerve and cranial nerve, whether it is blood supply, whether it is meninges, whether it is whatever it could be, guys, in the nervous system, one point please remember, as always, as you know, according to the new guidelines in the National Commission of Indian System of Medicine from 2022 onwards, for every structure that you read, please go with the clinical aspect. Because NCSM strictly tells these guidelines to teachers and the students as well that every class of yours should end with clinical aspects, and you should expose very early. In earlier days, when we used to be in BMS and all, there was no that strict guideline like we need to learn clinical aspects in the very first phase. It was not like that. When we used to go in the final phase, we used to get clinical aspects, clinical subjects and all, and then we used to learn the clinical, we used to get exposed to the hospital and all. But you guys, you are lucky enough because according to the NCSM, even in the first phase only, your clinical exposure will start very early. So please remember, while you write exam, and if you get any question, I'm not just talking about the nervous system, whether it is coming from respiratory system, cardiovascular system, whatsoever the question it may be, whether it is coming from Ayurvedic aspects like Srodhas, Kala, Siradhamanis, Ashya, Poster Sharira, or whether it is coming from the modern aspect like nervous system, direct question and all. So please mention clinical aspects, right? So that is very, very important. So let us go through how one by one. As you can see, you just now saw the, according to maybe, that could be, I don't know what exactly the thinking of the thoughts of NCSM. They have given for each point. There are 7 points, and forget about the non-lecture hour. 14 hours are there. That means for each point they have given 2 hours. So there are totally 7 points. So 7 into 2 is 14, and that's exactly what NCSM has given us. So please read or please finish the lectures or reading within 14 to 20 hours as far as possible. Okay. Next. So let's go with the introduction. As we so first of all, whenever I teach the nervous system to any of my students, whether it is PG or UG, the first thing that I say is what is actually the nervous system is meant for. Why this system is there in our body. So there is the nervous system always revolves around one important aspect, guys. That important aspect is stimulus and response. So what is the stimulus and response? Stimulus is a provocation and response is an appropriate response that we give to the atmosphere. For example, I am teaching to you what this is the stimulus. I mean, like you are able to listen to me. My words are approaching your ear, and then they are going to the temporal lobe through auditory pathway or whatever. And then finally, what is the proper response from you guys? You listen to me, and you are able to understand. You are able to analyze. If I say that the brain is there in the abdomen, will you accept it? Absolutely, you don't accept it because you know that you can understand, you can analyze whether what is right, what is wrong, and you will finally, get the point. So this getting the point is the response that one can properly respond to the teacher. So like that, in the morning, one of the models I was checking out there. So one was reflex arc. I don't know which team had done that one. So they have shown a limb there. The limb is touching a flame, and as the candle is ignited, the arm and the forearm will be taken back. So what is happening here? The stimulus is that burning. The flame is actually the stimulus, and you take the hand out of that harmful stimulus is actually the proper response, not any ordinary response. Proper response. So remember always, nervous system is one such system that revolves around always the stimulus and the response. And every point related to the nervous system is actually hidden in the stimulus. And like no matter, you can ask me any question related to this particular other than the stimulus and response. I don't really think that nervous system works best. Right? So the nervous system is entirely subscribed in this total doctrine or philosophy, what you can call it as stimulus and the response, proper response. So stimulus, if it is harmful, the response is going away from that. If the stimulus is really good, if it is nice, we will enjoy with that one. So that's the proper response. So this, whether to go away from that, understanding if that is harmful stimulus and I need to go from that, or no, that the stimulus is really good, I need to enjoy the stimulus. This is all told by your brain, guys. Right? Once your brain feels to check if the stimulus is harmful, or if the stimulus is enjoyable, then the life doesn't survive properly. Let us suppose if a cheetah is coming, if a tiger is coming, right? That's the stimulus. What is the proper response for that one? Should we run away from there, or should we, sit comfortably in front of the tiger? We should actually run away. That's the proper response, right? The day when we stop responding responding properly, right, to the stimulus, it is the day we need to understand that our nervous system is not working properly. So remember, when it comes to the nervous system, maybe today you may not understand this point, but tomorrow, right, when you start doing PGs or something like that, you will realize what exactly the stimulus and the response is. Can I have this, please? Yes, the next important point is classification. Like I said, within 40 minutes I am supposed to finish. I am here just to introduce you the syllabus of the nervous system. The very first important point related to the nervous system is classification. Right? So please remember that one. Like every slide, if I find in any particular slide, if I find that this question could come to the examination, I will be just highlighting that one. So one such thing, I am really focused with this classification. Maybe classification can come in the examination. Guys, remember that one. So when it comes to the classification, we have two types of classification. What is it? The first one is structural classification, and the second one is functional. So don't rush to write the functional classification. First write structural, because we are anatomic people. First we need to go with the structural things, and then we need to go with functional things. So when it comes to the classification of nervous system, we have two types of nervous system. Guys. One that is placed at the center, that is called central nervous system, that is comprised of brain and the spinal cord, and the other one is peripheral nervous system, that is composed of cranial nerves and the spinal nerves. And as we all know, there are only 12 pairs of cranial nerves are there, and there are 31 pairs of spinal nerves are there. So here you don't have to do anything but to I have the 12 pairs of cranial nerves. Maybe for 5 marks they may ask. I don't really think for 5 marks it will come, but they may ask each cranial nerve for 5 marks. Let us suppose they may ask olfactory nerve to describe olfactory nerve for 5 marks, or they may ask even your trigeminal nerve, which is the largest cranial nerve. They may ask it for 5 marks. So please prepare each cranial nerve in such a way that you should at least be able to write 2 to 3 pages along with a beautiful diagram, and that makes your 5 marks up to the mark with respect to cranial nerves. As far as spinal nerves, I really don't think they will be asked, but anyway, it's very important practically, because you see there are 31 pairs of spinal nerves are there, and these 31 pairs of spinal nerves will supply. There are no names, by the way, for spinal nerves. However, since they emerge from the spinal cord, they are called spinal nerves, and they will supply your thorax, abdomen, pelvic cavity, limbs, and upper limbs as well. And as the name itself it says, the cranial nerves are coming from the brain, and they supply your, especially the head and neck. There is one exception here. There is one cranial nerve that is longest, and it is not just limited itself. Its functions are not just limited to the head and neck. The functions of it are also extended up to the thorax and abdomen. Can I get to know which cranial nerve it is? Absolutely right. It is vagus nerve. Right. So when it comes to the classification, let me reiterate again. There is two types. One is structural, another one is functional. When it is structural, you need to write down central nervous system and peripheral nervous system. And when it is functional, there are actually, when it comes to the classification, we can write for pages together, guys. But we don't have that much time here, and we will not be having that much time there also in the examination. Let us go to the second classification, which is mainly functional. One is sensory, another one is motor. Like I said, sensory is always something that provokes a stimulus in you people. You all are listening to me, right? Is it sensory or is it motor activity? It's a sensory activity. And when I dictate something, and if I ask you to please jot down those things which I am telling to you, that's a motor activity or that's a sensory activity? That's a motor activity. So basically, sensory activity are the impulses travel from peripheral nervous system to cell. We already discussed that there are two types of structurally. There are two types of structurally. There is how we can classify the nervous system. One central, another one is peripheral. If the impulses are moving from PNS to CNS, we call it as sensory impulse or sensory activity. And if the impulses are moving from CNS to PNS, then that is called as motor activity. By the way, if you get any doubts at any given slide, you can interrupt me at that particular slide, or you can, once I finish my lecture, you can then also ask. I don't have any objection, guys. But feel free to interact, right? Because I am telling you once again, I am not here to teach in the just given 40 minutes. I am just here to introduce the nervous system, and I am here to tell you what is important in the nervous system. Yes. Let me repeat it again. As far as concerned with the functional classification, one is sensory, another one is motor. And remember, there are two types, according to sensory and the motor activities, there are two types of tracks in our body. How many types of tracks? Two. One is ascending, that carries the impulses from PNS to CNS. For example, spinothalamic tract, spinal cord to thalamus epilobe, right? And there is another track that is descending. That means it is analyzed and what to be done. It will give the brain is a commander. It gives a verdict, it gives an order, and that order will be followed by my order. For example, I am standing here, I want to move there, I will move. So I don't automatically, it didn't come from there to here. My brain told me to do that one. So this comes by means of descending track, and descending track refers to, yes please, it's a motor activity. And one best example for the descending tract is corticospinal tract. As the name itself it says, it is coming from cortex and it is ending in spinal cord. And from there, from the spinal cord, you all know very well, spinal nerves will leave the spinal cord by taking the command received from the brain, and they will go to the peripheral structures like muscles and all, where the activity is actually done. Right? If there is any doubt related to the ascending and descending tract, feel free to ask me later or otherwise. Shall we go with the next one? Yes. As according to the syllabus, let me directly go to the meninges. Meninges. What are meninges? Just like any other organ in our body. Your heart is covered by the pericardium. Your lungs are covered by the pleura. Your abdomen organs are covered by the peritoneum. Isn't it? Right? Your muscles are covered by the deep fascia. Tell me one structure in our body which is not surrounded by any connective tissue. There is no literally. One bone is connected by the periosteum. Your entire body, of course, is connected by the skin, which is again connective tissue. Likewise, since brain is a very important, delicate organ, brain is also covered by three types of connective tissues plus, and these three types of connective tissues are the first one from outer side to inner side, the dura mater, the retina mater, and pia mater. So please remember, at least you should be able to write 5 lines regarding each matter, at least 5 lines with a good diagram. Dura, what is dura? It is durable, right? That is dura. What is matter? Matter means mother. Mother is the one who protects us. In the same way, meninges are the one which protects us. So, dura means durable, matter means mother. In the same way, arachnoid. Arachnoid means something that is like web-like. जैसे web spider की web तरह होता है, वैसा ही आपका arachnoid matter होता है. That's why it is being named as arachnoid matter. That is placed right next to the dura matter, deep to the dura matter. And then comes pia matter. Pia matter is something that is so closely invested to the central nervous system. Remember, these meninges, what I was referring to, these meninges are only present in the central nervous system. Please remember, peripheral nervous system is not covered by the meninges. However, peripheral nervous system is covered by epineurium, myoneurium, and perineurium and endoneurium. So that's a different connective tissue, and this is a different connective tissue. So as far as concerned with the coverings of the PNS, they have not put it in the syllabus, and I don't really think that is important. But what is important with respect to coverings is meninges, which are central meninges, which are dura mater, arachnoid diameter, there is one space is there. That space is called epidural space. What is that space called? Epidural, right? Where you can inject some anesthesia and all, you can make a particular part anesthetized to perform some kind of operations and all, right? Even epidural hematoma, usually whenever somebody falls, you see epidural hematoma can also happen. It is not that fatal as well, though. Then comes subdural space. The subdural space is present between dural element and arachnoid element. यहाँ पे भी आपको hematoma or any kind of hemorrhages हो सकता है, right? So there is nothing. Actually, subdural space is you see it is not that it is not that distinguishable, right? It is a very narrow space, and technically you don't find any important structures there. However, important thing, substance is found below the arachnoid matter. That space is called subarachnoid space. So what is the subarachnoid space? The space that is present between arachnoid matter and pia mater. So what is present here? A very important nutritive substance is present within this space, and that nutritive substance is called cerebrospinal fluid. जिसके बारे में हम बाद में बात करेंगे. We'll talk about this one later. Anyways, please remember, where is CSF present? CSF present in subarachnoid space. And then comes, there is no subpial space because, like I said, pia mater is deeply connected with the central nervous system. So there is no technically subpial space. Right? So please remember, with respect to meninges, yes, they will ask in the examination for 5 marks. Remember all the methods, remember all the spaces, remember the clinical aspects of all the spaces, if possible, and with the beautiful diagram. That makes your knowledge of meninges concrete. Okay? Yes. After discussing the meninges, we can go to the next one. That is, yes, let us dwell into the important things, which are the structures of central nervous system, especially. Excuse me. Sorry, right? I was getting calls and wanted to that. So yes, what I was telling you that mainly with respect to the central nervous system, there are two important organs. One is the proximal twist, brain, and the distally the long tubular one, that is called as spinal cord. It is these questions that will come in the examination for a grand 10 marks. Please after you can put it down in your diary guys, but definitely in paper 2 either you will get at least brain or you will get spinal cord. So it is really important to be well prepared with the brain and the spinal cord. So let me go very briefly with respect to brain, and then let me discuss with the spinal cord. So as you are looking there, this is actually the brain, which is composed of mainly 3 parts. How many parts? 3 parts. The more well developed in human beings, the most well developed part, you know what it is? It is called telencephalon or forebrain. What you are seeing there, which is covering the rest parts. The most convoluted, that has got elevations and depressions, that is called forebrain. And within that forebrain, deep side at the center, there is another brain which is located in the middle of the brain, and that is simply referred as middle brain. And last but not least, there is another brain that is located in the inferior aspect of rest of the things, that is called hinterbrain, which is composed of 2 things. Anteriorly the brainstem, excluding midbrain, and posteriorly the cerebellum. So basically, hinterbrain is composed of 3 parts. Posteriorly the cerebellum, and anteriorly the pons and medulla oblongata. Right? So then this is about the general features of the brain guys. Now let us discuss one part by another part very fastly. The very first part, the most well-developed part, like I said, what is the most well-developed part? Telencephalon, cerebrum, forebrain. You can call it as cerebrum, right? So cerebrum is the most well-defined, well-developed, and like a visible part. As soon you remove during craniotomy or wherever, it is very easy to visualize. Even during dissection as well, it is very difficult here. This part is called petrous part. However, the next part is called anyways, what I was telling you, the most well-developed part among the brain is cerebrum. Right? What the cerebrum is composed of? Maybe as you can see, when it comes to anatomy of any structure, what is the thing that you write guys in the very first right after size and dimensions that December you write? That is there. After that one, yes, external features. When it comes to the external features, 2 things are very important for us. One is borders, another one is surfaces. Your brain is not exceptional. It has got some borders, and it the cerebrum. It has got borders and surfaces as well. Maybe the one surface which you are seeing there, that is called superior-lateral surface. What is that surface called? That is this is the brain, the superior and the lateral surface. This is called superior-lateral surface. And the other side, the other, like the right. This is the opposite side of the superior lateral surface. What is this? This is called medial surface, guys. What is this surface called? Medial. And last but not least, the bottom surface which you can see there, where there are some depressions, that is called inferior surface. So basically, your cerebrum is made up of how many surfaces? 3 surfaces: the superior lateral, the medial, and the inferior. I think among these 3 surfaces, I really feel superior lateral surface and the inferior medial surface are very important, because superior lateral surface is that surface where you will find more number of areas which are classified as broadening areas. Whatever that work we do, every work, every action of ours, every sensation is all controlled by each area that is present in the superior lateral surface. And as such, there are some n number of surfaces, some say 180, some neurobiologists will say 52, but there is one neurobiologist who is called Brodmann. What is his name? Brodmann, and he has classified the areas into how many? 52, right? Well, I can't say all those 52 right now because I need 1 hour to read that one only, but in brief, let me finish it off. The Brodmann's areas are classified based on what activities that the cerebral hemisphere will do. See, as you can see, this is the anterior-most part, and this is the posterior part, right? And you all know maybe that the cerebrum is covered by the cranial bones. Yes, sir? Yes, they are covered by which cranial bones? There is frontal bone, there is parietal bone, there is temporal bone, and there is occipital bone. And you should know that based on the cranial bone, that is under which the cerebral part is under coverage, the cerebral area is named with that one. For example, this part of the cerebral area is called parietal lobe. This part is called temporal lobe. This part is called frontal lobe, and this part is called occipital lobe. So let me just go fastly telling each of the lobes and their functions. So frontal lobe is basically concerned with the motor activities. Which activities? For example, I am speaking here, I am walking here, I am holding a mic. So this is all controlled by frontal lobe. Parietal lobe is something like I was just getting the calls and I feel that I am holding the mic and you all are able to listen to me and you all are well aware about what you are hearing, where you are, like, what is the surface, whether it is hot surface or cold surface, all these things you are able to understand and acknowledge. So these kind of activities are called as sensory activities, and these sensory activities are controlled by parietal lobe. So basically, the motor activities are controlled by frontal lobe and the sensory activities are controlled by parietal lobe. Rest special sensations, for example, like say vision, like audition, like olfaction, like taste. These sensations are specially present in temporal lobe and occipital lobe. Right? In the temporal lobe alone, you have auditory area, you have got taste area, and you have got olfaction area as well. However, the visual area is specially placed in one such lobe, and that lobe is called occipital lobe. That's why maybe during childhood you might have heard that people telling not to eat here, right? That's because your vision will become blurry. Why? Because this is the area which is called like visual area or visual cortex, to which sometimes if you hit fastly, the concussion or any injury or any trauma can happen. That is the reason why usually we say not to eat here. But anyways, coming back to the point, as far as concerned the cerebral hemispheres, there are basically 4 lobes: frontal lobe, parietal lobe, temporal lobe, and occipital lobe. Frontal lobe is concerned with motor activities, parietal lobe is concerned with sensory activities, temporal lobe is concerned with special senses except vision, occipital lobe is concerned exclusively with visual activities. Is that right? So, as I told all these things, please relate them to the cranial nerves. Right? For example, olfaction is related to olfactory nerve, vision is related to optic nerve, isn't it? Taste is related to facial nerve, vagus nerve, glossopharyngeal nerve. तो इन सभी nerves का please pathway आपको. For example, optic nerve, it starts here and it will end in the occipital. Now that we are trying to establish the connection. So where does olfactory nerve start? Olfactory nerve will start in the nasal mucosa and it will end in the middle, somewhere in the medial aspect of the temporal lobe. So like that, where does taste sensation will arise? It will arise in the tongue, and then they will go through. That is one, like facial nerve. I tell you, it is one of the very complicated nerve. Please remember, read the facial nerve very properly. Though we say vagus nerve is longest nerve, the most complicated, most irritating nerve, if there is any among the cranial set, that is facial nerve. That much complicated, that much like when we pass through a hairpin bends, hairpin bends will be there in sometimes some western guards. How difficult to drive there. Exactly the same way it is so difficult to read the cranial nerves because it is so twisted. Its pathway is something like very vague and it is like you can't track it, trace it properly. So that facial nerve, right? One of the branch is there, facial nerve branch, which is called cauda tympani. Cauda tympani perceives the taste sensations from the anterior to the and again from posterior one side to the glossopharyngeal and again root of the tongue, the vagus nerve. So all these three nerves will pick the taste sensation and they will go to the temporal. So please read the origin, read the destination, and read the pathway. You are done with the pathway. You are done with the cranial nerve. Of course, however, never needless to say, one clinical anatomy, one beautiful diagram. Right? So that is as far as concerned with the cerebrum. Let us now move to the brainstem. Right? So previous. This is okay. Next item. This is also okay. Fine. Now. After discussing the cerebrum, okay, I talked about the superior-lateral surface. Let me very fastly discuss about the medial surface. Now, what you all are seeing, this is medial surface. So, in this medial surface, mainly what you get is, what is the weight of brain? I'm sorry, I forgot actually to tell you. Yes, it is 1 point. Right, 1.5 kgs. Liver is 1.5 kg. Yes. Right, 100 grams less. 100 grams less. It is 1.4 kg. Even though we have 1.4 kg, right? We don't feel any head. Like imagine, like keeping some 1.1 kg or 2 kg stone on your head. Is it possible to live with that one, guys? Absolutely not possible. But even then, within our cranial cavity, we are holding 1.5 kg substance. Why don't we get any headache? That's buoyancy. Buoyancy. What is buoyancy? It is the ability to float, right, within a liquid media. And that liquid media, you all know that liquid media is called cerebrospinal fluid. Cerebrospinal fluid has got some particular locations there within your brain where it is present and it will pass through. And those structures which accommodate the cerebrospinal fluid, they are called ventricles, guys. What they are called? Ventricles. Yes, for 5 months you may be asked. I am not sure about this one, but you may be asked. But please be careful with this question. Ventricles. How many ventricles are there? Basically, 4 ventricles. 2 lateral ventricles, and then there is third ventricle, and then there is fourth ventricle. And this fourth ventricle, you see, it will continue as central canal in the spinal cord. So these 4 ventricles, lateral ventricle, third ventricle, and fourth ventricle, they are present in the brain. The central canal is present in the spinal cord. So the CSF circulation will start at the lateral ventricle. It is of course produced by capillaries of choroidal plexus, right? Anyways, we will read it all those. So CSF circulates. Its initiation of the circulation will start at the lateral ventricles, and from the lateral ventricles, the CSF will move to the third ventricle, and then it will move into the fourth ventricle, right? And finally, it will go to the central canal. Meanwhile, the excessive CSF will be there, and that excessive CSF will escape through some specialized cavities within the brain. Those specialized cavities within the brain are called cisterns, guys. What they are called? Cisterns. And from the cisterns, your arachnoid matter will absorb it into the subarachnoid space, and from the subarachnoid space, the CSF will go into the arachnoid granulations, and from the arachnoid granulations, finally it will reach to the sinuses. So that is something about the CSF circulation. Actually, I was supposed to deal with this CSF circulation last but one slide. There I was supposed to discuss actually. Why did I discuss here? Because I wanted you to understand we are talking about the medial surface, and medial surface is mainly composed of cavities, and these cavities are your lateral ventricle, third ventricle, and fourth ventricle. And the structures which are present in the medial surface will surround these cavities. I repeat it again. The structures which are present in the medial surface of the brain, they surround these cavities. That's the reason why these cavities are called as circumventricular organs. What they are called, please? If you pronounce it, it will like the new terminology may get registered. So try to, it will even help you to get rid away from sleep as well. Some of you sleep, right? So that's a good trick to talk or to pronounce the things what I am telling you. So these organs are called circumventricular organs because they are situated around the ventricles and they are very important. They are vital as well. For example, thalamus. Heard of thalamus, guys? Thalamus is a very important final relay station. You are here able to you had sumptuous lunch, you tasted, you are seeing me, you are able to, like feel the sensations of the table, the computer, the watch, that etc. etc. Right? So all these sensations are understood by your thalamus, and the thalamus will relay the sensations that are received by it from the peripheral organs to the respective cortex. Remember. So that's the very important aspect of thalamus. अगर आपका thalamus को injury हो गया समझो, then he will go into coma. He will lose your consciousness. You are not able to, even if somebody touches you, somebody says anything like that, imagine a vegetative state where a person don't react to any of this external atmosphere. So that could be a result of like injury to the thalamus. So ऊपर thalamus है, उसके नीचे सीधा उसके नीचे और एक very important huge organ is there, and that huge structure is called hypothalamus. Guys, what it is called? Literally, most of the functions related to the human body are totally controlled by the hypothalamus. Right? I was talking about autonomic nervous system, right? Autonomic nervous system is made up of mainly two sets. One is sympathetic and one is parasympathetic. The sympathetic and parasympathetic are totally controlled by this hypothalamus. Everything, your emotions, you see like food intake, water intake, right? So your anger, your everything, right? From the psychological aspects to the physical aspects to the mental aspects, each and every function, action, sensory, whether it is motor, especially related to involuntary aspects like perhaps abdomen and pelvic cavity, all are related to hypothalamus. So remember, please, two important structures with respect to circumventricular aspect. One is thalamus and one is hypothalamus. Apart from that one, yes, there are pineal gland is there, hyaluronic nuclei is there, like corpus striatum is there, so like circumventral. There are so many other structures are there. At least please, like write, jot them or remember them at least. But as far as consider the medial aspect, I want you to remember are really two things which are one, the thalamus and one is hypothalamus. Moving on now, let us discuss the midbrain. Midbrain is from brainstem. Brainstem is composed of mainly three structures from superior to inferior. How many structures, guys? Three structures. These are, the first one is midbrain, the next one is pons, and the third one is medulla. Right? The midbrain has got again three parts. The crus cerebri, from anterior aspect to posterior aspect. First is crus cerebri, and then tegmentum, and then there is tectum. So basically, the midbrain holds your entire cerebral hemisphere. See, imagine, it is such a small structure, but it holds the entire huge two cerebral hemispheres, right? Such a energetic structure. So apart from that one, the midbrain is a conductor. Entire brainstem is a conductor for ascending tracts and descending tracts. Especially the midbrain is involved in mainly the activities related to your eyeball. You see, how many cranial nerves we discussed already? There are 12 cranial nerves, no? Among these 12 cranial nerves, the first two cranial nerves, what are those first two cranial nerves? Olfactory and optic. They come from cerebrum, guys. From where they come from? Cerebrum. And the next two cranial nerves, what are those? Third and fourth. What are those? Oculomotor and trochlear. They come from middle brain. That means to say, if they are coming from the middle brain, it is understood, guys, that the middle brain will control the movement of the eyeball.